Hello, hi, good wishes. I'm Dr. Premnath, Senior Resident from Department of Community Medicine of Sri Lakshminarayana Institute of Medical Sciences. Today, our topic of discussion will be on Poshan Abhiyaan. Okay. So the overview of our discussion will be on what is the global and national targets and what is the program structure, what is the aim and objectives, target and impact, what are the pillars of mission, that is strategies, and with pinpoint to nutrition strategies, and what is the implementation mechanism and monitoring mechanism. So the global target, sustainable development goal of UNDP, goal 2 indicates zero hunger. So under goal 2, the target 2.2 in specific indicates by 2030 we should end all forms of malnutrition. Okay, including, it also includes by 2025 there should be an internationally accepted targets on stunting and wasting should be achieved. So what is the 2025 target? Is nothing but reduce the number of children in under 5 age who are stunted by 40%. Okay, who are stunted should be reduced by 40%, and wasting should be reduced to less than 5%. And there should be no child with overweight, and reduce the anemia percentage by 50% in women of reproductive age. These are the important global nutrition targets of 2025. Now, when we see the current status of India with respect to nutrition, we can see in stunting around 38.4% of the child under 5 children are stunted. That is height for age in which their stunting is present. That is below 3rd percentile. And the second bar indicates a CNS survey, that is Comprehensive National Nutrition Survey. And that survey also indicates around 34.7%, that is 1/3 of the children are stunted, and 1 in 5 under 5 children are wasting, that is around 21% are wasted. And when we see underweight also, around 1/3 are underweight. Interestingly, anemia prevalence is 59%. Okay, see what a huge burden it is. This slide indicates the specific indicators under nutrition, such as percentage of breastfed within 1 hour. That is only 41.5% of the children are breastfed within 1 hour. And what is minimum dietary diversity? That is the minimum food groups they should use the mix of food groups. Okay, the percentage of minimum dietary diversity is followed by only 21%, or around 21 to 22%. And minimum meal frequency, okay, for breastfed children after starting the complementary feed, it should be at least 2 within first 3 months, and it should be 3 from 9 to 1.5 years, and it should be at least 4. If the child is not breastfed, it should be at least 4. That is minimum meal frequency, and this is also followed by only 1/3, around 36% are following this. So when we combine both this, it is called as minimum acceptable diet, and only 10% are following the minimum acceptable diet of that age. See how much lack they are not following. Okay, most of the bars are not even crossed 50%. So this shows the burden of that nutrition status. With this background, we will discuss Poshan Abhiyaan. So what is Poshan Abhiyaan? It's mainly concentrating on nutrition part. Okay, this slide indicates a vicious cycle of undernutrition. If we see, it starts with protein energy malnutrition. If they have any protein nutrition energy deficit, they will not work. They have low working capacity because they don't have energy. If they have low working capacity, means the income generation will also be decreased. Okay, if the income generation will be decreased, means they'll be ultimately landing in poverty. If they land in poverty, means they won't purchase adequate vegetables, fruits, etc., And again, the circle will continue. Protein energy malnutrition, working capacity will be decreased, income will be decreased, and they'll be landing. This outer circle indicates the vicious cycle of undernutrition, and the inner circle indicates the intergeneration change. That is, if a girl child is stunted, means child will grow as malnourished girl. There's a chance for continuing as malnourished mother, and malnourished mother will give rise to a low birth weight infant, and this low birth weight infant may eventually land as stunted child, and again this cycle continues. This is intergeneration cycle. So see how it is interlinked. So what is this program? Who introduced this program? When? Why? How? Okay, this 5 question will answer. It is a multi-ministerial convergence mission. Okay, in order to achieve the reduction in malnutrition, that is to achieve the SDG goal 2. Who launched this? Prime Minister on 8th March of 2018. Okay, to improve the nutrition status of not only the children, both pregnant mother and lactating mothers also. So why this? There's a program previously ICDS or multiple nutrition programs. Why this in specific? It is an umbrella program. That is, there's a lack of synergy previously. This program mainly concentrates on synergy, that is convergence and linking the schemes and coming into common goal, that is common umbrella. So it eventually started in 2017 in 18 in 315 districts and gradually increased, and by 2019 to 20 around 583 districts were covered, that is whole of India is covered, and the Ministry of Women and Child Development plays a major role in this. When we see the financial mechanism, here it is important to concentrate that don't concentrate on the figures. If you see the splitter, the 50% is covered by the government budget and 50% by the bilateral agency, international bilateral agency. And in 50% of the government budget also, 60% will be having this central share and 40% by the state share. And it varies for northeastern states. The important point to be discussed is it has an international support. In any time future, international bilateral agency stop the funding, there might be a crisis in the fund. And if also the central government, if there is a reduction in the percentage of sharing, there might be a financial crisis. So this program has been implemented. It should have a sound financial mechanism. Okay, but the current mechanism is 50% by government, 50% by international agency. In government also, there's a split up between central and state. So it has a various strategies under this. The main strategies will be concentrating to reduce the level of malnutrition and creating a synergy and convergence mechanism. Okay, in order to make the beneficiary group nutritionally sound. The main apex body, whose apex body will see in the organization structure. They monitor, they supervise, they fix targets, and also guide the nutrition related intervention. Okay, the main aim of this program is holistic development and adequate nutrition. Holistic means it is a multiple composition of all the aspects, both physical, mental, psychological. It is a holistic development to give an adequate nutrition to the beneficiary group. In specific objective is to reduce the stunting. Okay, you see 30% was the stunting prevalence, and it should be reduced by 40% by 2025. So to reduce stunting and to reduce all other parameters of malnutrition like wasting, etc., in identified districts by key utilization of the Anganwadi. Okay, because Anganwadi, all the services, that infrastructure can be used to deliver all the service that is needed to the beneficiary group with quality. The important thing is with quality. That is the most important. The organization structure, if you see from left to left side, from top to down is the monitoring guidance. And towards the right, if you see, It is a bottom-up approach. That is, planning will start from the block committee to the national level, but the monitoring and supervision of this will happen from the top to bottom approach. Okay, so the planning is, it starts from block convergence committee. Block convergence committee also has a village health guide, panchayat institutions who are all at the level of village, etc., will be combined, and what are their needs, and what is the exact prevalence, and what are the steps can be taken, and plan will be drawn, and it should be sent by December 15 to the district convergence committee. From district convergence committee, it reaches a state convergence committee. Okay, it should be reached by December 31st. From December 31st, it should reach to the national convergence committee by January 31st. This is planning, bottom up approach. Once a plan is drawn, okay, that is POP, that is what is the program plan has been drawn, the budget will be allocated, the strategies will be started, and monitoring mechanism is important. Okay, what is happening? That will happen from the top to the bottom. Okay, that is, after implementing the PIP, the monitoring will start from the national level to state level to district level to block level and to the ultimate bottom line. So we'll see what are the targets. Okay, what are the targets? Main target is, it is per year. Okay, it's not 2025, per year. And under Poshan Abhiyaan, stunting and undernutrition should be reduced at least by 2% per annum. From the current prevalence rate, there should be at least 2% reduction per annum. Okay, anemia should be 3% reduction, and reduced low birth weight. Low birth weight prevalence also should be reduced by 2%. Okay, so the term Mission 25 by 2022. What is Mission 25 by 2022 is, stunting from 38.4% should be brought to 25% by 2022. So 25 means by 25%, and it should be brought by 2022. This 38.4 is taken in the NFHSO survey, that is on 2015 to 16. From that year onwards, each year there should be 2% minimum reduction. That is around 6 years, I guess, 16, 17, 18, 19, 20, 21, 5 years. If you reduce means, at least there should be a 25% stunting target should be achieved by 2022. But with this COVID scenario, unexpected scenario, the chance of reaching might be difficult. Okay, let's see what happens on 2022. So if this is impact, if this is proposals, etc., or implemented, means what the impact we can see, what is the change we can see, is that there will be a reduce in the level of stunting, undernutrition, anemia, low birth weight babies. Also, there will be a great synergy, that is synergy between women and child development and other ministries like health ministry, Ministry of Health and Family Welfare, and also other ministries like environment, Swachh Bharat Mission, etc. There will be synergy, and it will be working in a group. So, and also better monitoring. Till now, what happened might be not there, but now the monitoring mechanism is also drawn up and ensures timely alerts, because this is under digital platform. Now it is developed on a digital platform for monitoring. So in an area, if the stunting prevalence is higher, or if it is not reduced as per the target, that is it should be reduced 2% per annum. If it is not achieved, means timely alerts will come, and the supervisors can take the action on that block. And also it ensures the state and union territories to perform, guide, and supervise the line ministries to achieve the target goals of SDG. This is the impact that we expect if program is rolled out and successfully implemented, and the end result might be this. Till now, okay, this I assessed in 2020. what is the percentage of participation by each state in India under Poshan Abhiyaan. This green color indicates a good number of participation. Okay, that yellow color indicates below average participation, and red indicates no participation. And most of the southern states and in the west also there's a good participation, but northeastern states, if you see Mizoram, Assam, Uttarakhand, etc., there's some poor participation that is below average. So it should be concentrated more. So what are the proposal? What are the plan under Poshan Abhiyan is first a mapping of various schemes. That is, what are the malnutrition schemes previously available should be first mapped, and what are the new plans that can be rolled out also should be mapped. And robust convergence mechanism. All the ministries who is working to help nutrition increase support should be converged, and real-time data monitoring system. Okay, it is a digital platform, and also they are performing all the workers from starting from lower to high grade. So there should be incentives to the bottom frontline workers like Anganwadi workers, and also best performing states UTs should be given award, so that it will encourage them to keep the performance and other states to come into the level of the others comparative states. Okay, this incentives mechanism. And social audit. The term social audit means community participation. The community members will come, and in the planning stage, they will audit what are the implementation of activities, and they also give their suggestions, etc. And nutrition resource centers are established under this. Okay, central project management. That is, it has a resource center. It has any research. What are the prevalence, etc. What is as you show now in the previous map? What is the percentage of participation in states of India, etc. will be available in nutrition resource center. That is when our apex body has been established, and eliminating the registers. Previously, they are maintaining the manual registers. Okay, that has been eliminated and replaced by real-time digital monitoring system. And Jan Andolan, that is people's participation. These are the proposals, broad proposals in Poshan Abhiyan. What are the main pillars? Okay, supporting pillars are based on the proposals. It is a real-time digital monitoring system now. Based on that, ICDS CAS has been developed. That is Integrated Child Development Service Common Application Software has been developed. This is that software where the Anganwadi teacher will have this in the tab or cell phone. And what are the features in this tab means household management, collect the information, demographic profile, what are the households, what is the health status, etc. can be collected and kept in the household management part. In daily feeding, what is the daily feeding activity in the Anganwadi center to be recorded daily, and house visits, what are the houses visited by the Anganwadi teacher should be recorded, and what is the growth monitoring when you visit, if they take the height and weight should be recorded in the growth monitoring, so that it will integrate whether the child is malnourished, wasting, stunting, etc., so that suitable action can be taken. All this can be done using ICDS software. And also take home ration, what is available, what is distributed to the population, what is the stock, etc. can be maintained. What is a due list? What is a due list means it also includes like, who are the beneficiaries for the VHS and it is village health sanitation nutrition day, who are the beneficiaries, what is the vaccination status, etc. can be any due status is means it can be noted under the due list. And Anganwadi management, like what is the infrastructure, what is the utensils, etc., what is the logistics maintained there, any requirement there, etc., can be maintained in the Anganwadi management. And monthly progress report also available in consolidation. This software contains all this. And second pillar is convergence. Third is behavioral change, training and capacity building, innovations, incentives, and flexi activities. Let us see. We finished ICDS CA software. Behavior change. So behavior change is important. Though till this long years, many nutrition programs has been implemented at the ground level, the success rate is low, because if we see the stunting is 38.4%, because stunting indicates a chronic malnutrition status, no? So their behavior change also is important. For this, Poshan Ma is celebrated, Poshan Pakwada is celebrated. That is, they'll be allocating a separate month. In Poshan Ma, September month is allocated especially for this activity, so that the community will participate in this event and also create the awareness among the community members to take the nutrition, what is make the awareness, what is the nutrition status, and participate in the event and also get benefit under this. What is Jan Andolan? Jan Andolan indicates people's movement. Okay, here the public participants will participate and will create the awareness. This is also called as a people's movement. The main themes under Jan Andolan will be antenatal messages, optimal breastfeeding, complementary food, immunization, growth monitoring, etc. Will be the key themes under Jan Andolan. So the convergence, as I told, no pillar, the convergence will be between various ministries. Some of the few examples are given. Under Ministry of Women and Child Development, Poshan Abhiyaan, ICDS, etc. can be club. Under Ministry of Human Resource Development, midday meal scheme. It also concentrate on nutrition, no? UDIC is an school program. Ministry of Health and Family Welfare, we are having MA, that is Mother Substitute Affection, RKSK, Rashtriya Kishore Shakti Yojana, Anemia Mukt Bharat, Intensified Diarrhea Control Fortnight, Indradhanush, Home-Based Newborn Care, Home-Based Young Care, Rashtriya Bala Swasthya Karyagram, and National Health Mission. These are all concentrating on nutrition component also. And under Ministry of Drinking Water and Sanitation, Swachh Bharat Mission. Okay, Swachh Bharat Mission is important. And Ministry of Rural Development, there will be an MG so that is Mahatma Gandhi National Rural Employment Guarantee Scheme. Under this, there can be earning, that is supplementation in income generation, so that they might purchase the healthy foods and have it. So like this, convergence mechanism is important. And also the community members, important key stakeholders, participation is also important, no? For example, under Ministry of Health and Family Welfare, ANM can be included, ASHA can be included. Under Ministry of Rural Development, self-help groups can be included. Under Ministry of Human Resource Development, teachers can be included. Even included means it can be in Jan Andolan movement, on Poshan Ma celebration, etc. That is to create awareness. They can be used. Under Ministry of Youth Affairs, in NSS volunteers, NCC volunteers can be used. Under Ministry of Defense, NCC volunteers can be used. Under Ministry of Agriculture and Family Welfare, National Cooperative, that cooperative society members can be used. Under Ministry of Drinking and Water and Sanitation, Swachhagaryas can be used. It can be not used, they can come forward and participate in the event. And also partnerships can be made. Okay, partnerships with influencers like celebrities. Okay, if an advertisement or etc. made by a celebrity, it has some impact. It has a good impact, no? So that can be done even with the private sector. That is for corporate social responsibility. They might allocate few fund, or some private sector voluntarily will contribute to this in movements, etc. And academic institutions, students can be involved, and also volunteers can be involved. With this, participation is important. Like this partnership will create a huge mass, so that there will be a good awareness in that community. As I told, in this sum up diagram, transmedia approach, that is various things in individual influences level, celebrity influences like local leaders, frontline workers, etc. can be included in individual level. Under community level, all the school teachers, NSS volunteers, etc. can be included. Under media side, both social media, community media, outdoor media, mass media, etc. can be included for these platforms. Under Village Health Sanitation and Nutrition Day, each month one thing can be adopted, and that is concentrated on the day. The health messages, the information that the community needed can be delivered. For example, in January, they can take the theme of full immunization and vitamin A supplementation. What is the benefit? Why they should immunize? What is the importance of that can be taken. In February, food fortification, importance of micronutrients, why deworming should be practiced, etc. can be impacted. Like that, every month one theme can be adopted and awareness can be brought among the beneficiaries. And community-based events, like example Annaprasam, that is complementary feeding. Okay, the mothers can be invited to Anganwadis and they can ask to cook complementary feeding, and the best food etc. can be rewarded with some gift. So the others also will come to know what are the complementary feeding available, different types, different items, and what food groups can be mixed etc. can be made aware. Okay, and Poshan Divyas, that is male guardians also should be involved. No, why only females in the care of child? Males also should be involved. So Poshan Divas can be celebrated, Goth Barai, and also general discussion. Like the theme-based events also can be conducted. And innovative approaches. For example, if you see, I have placed two pictures. And the first picture, child ambassador. That is, school students can be made as an ambassador. That is, they will go into the community and act as an ambassador and cause awareness among the people. Okay. And also cooking competition can be made for complementary feeding and rewards can be given. Like that, some innovative methods also can be adopted at the community level. And pillar, one of the pillar mechanism is capacity building. For this incremental learning approach, what is nothing but it is also an app which contains the videos regarding what are the things that can be delivered to the community. This is available in the same tab or cell phone which the Anganwadi teacher uses now. In this incremental learning approach is impacted, that is, they can have the look on videos, they can gain knowledge. For example, if they're going to growth monitoring means how to look for height, how to look for weight, what is the frequency they should visit, etc. can be learned. Okay, what is the main advantages? There's no need for face-to-face intervention. They can even sit at the center or in the home and look for the videos. And also they can use this to educate the community when they go to the field visits. And another pillar is incentives. Okay, so the best performing states should be given incentives. In national TV elimination program, they're giving incentives, no? Like for example, bronze medals, silver medal, gold medal. Like this for Poshan Abhiyaan also, incentives will boost the performance of the state, and also the other states will be encouraged to come up to that level. So national award, field level awards, state level awards can be given. Okay, not only to the state level, to the frontline workers like Anganwadi worker, Anganwadi helper can also be incentivized. Okay, there's a few eligibility criteria. What is the performance? What they should fulfill in order to get an incentive or given in detail. Okay, for example, they should do growth monitoring 60% of the children less than 2 years they should do, and they should open the Anganwadi at least 21 days in a month, etc. This incentive can be in monetary basis or in award basis also. And the next heading in our topic of discussion, nutrition strategies and intervention on the Poshan Abhiyaan. What are the nutrition strategies? Or infant and young child feeding. Sorry. On infant and young child feeding practices, what are the minimum dietary diversity, minimum meal frequency, minimum acceptable diet can be taught to the mother, and how long the breastfeeding should be continued, when the complementary feeding should be introduced, etc. can be given in under infant and young child feeding. Okay, food and nutrition, immunization strategies, because rotavirus will prevent the diarrhea. And institution delivery, water, sanitation and hygiene, hand washing technique, deworming twice in a year, that is on February and August, can be given. And ORS zinc for the patient, for the child who is suffering from ADD, acute diarrheal disease. Food fortification. Okay, for example, holiday meal will be given in ICDS. What is holiday meal means? They'll be getting the supplementary feeding when they reach the Anganwadi center on working days. Okay, if it on Saturday or Sunday, if it is on holiday means they'll be given a holiday packet which contains the required calories, proteins, micronutrients, etc. They can mix in the water and the beneficiary can have it. So food fortification, dietary diversification, that is different food groups should be included. Adolescent nutrition, that is also important. They are also important beneficiary under this. Maternal health and nutrition, because intergeneration link is there. And early childhood development, early childhood care and education like preschool education, that is, and also stimulating the child, etc. And convergence and ICT mechanism, capacity building. So as I told you, there is a national resource center, nutrition resource center has been established. What is the apex body is called as National Technical Board of Nutrition. Okay, they have the technical, responsive, and evidence-based recommendation they will give, so that based on their recommendation, policy-relevant issues can be addressed and operation guidelines can be brought in. For example, till now, operation guidelines for the management of severe acute malnutrition, or operation guidelines for the infant and young child feeding practices, etc., are available based on the technical recommendation from the National Technical Board of Nutrition. It is a National Resource Center for Nutrition. As I said, this program has been implemented in phase wise. Okay, starting from 2017 for around 300 districts, and it ended with 2019 to 20 through by including all the districts in India. And intense monitoring is important. Implementation will not stop with that. There should be monitoring mechanism. There should be supervision. Okay, monitoring is nothing but whether it is going on the correct road. Supervision is nothing but giving the suggestions how to improve, etc. So this is the broad picture showing the what is the change, what is the input, what is the process, that is impact assessment. What is the assessment? Okay, can be made by this chart show what is the input, how many human resources are there in the Anganwadi center, what are the supplies are there, what is the infrastructure, what is the logistics, what we are given as input. Based on input, whether they are working process, whether they are addressing all the pillars under Poshan Abhiyaan. If they address all the pillars, means there should be some outcome, no? So whether output is there, whether there's an improved availability of all the facility when compared to previously, and whether it is on quality based, etc. When the output is there, means there should be an outcome. Outcomes means important determinants, that is improving the determinants of the nutrition. That is, the people may be aware and follow the IUICF guidelines, practices, that is minimum dietary diversity. They will voluntarily come for immunization. They will voluntarily come for vitamin E supplementation, growth monitoring, etc. If that is all done, means it will have a great impact. That is our national targets and WHO targets will be achieved, so that there will be a better child growth and reducing the anemia, reducing low birth weight, reducing stunting, reducing the wasting also. So this is a broad classification for impact assessment. And monitoring mechanism, as I said, no, it is mainly by the joint from each level. From the top level, it can be joint program director, state program management unit, district program officer, community development program officer, supervisor. Okay, they will have a supervisory checklist. Okay, in the checklist, some of the information like Anganwadi center attendance, whether it is opened, what are the beneficiaries coming in, whether they are getting all the things that are meant for them. For example, supplementary nutrition they are getting in, whether the home visit made by the Anganwadi worker, whether infrastructure is adequate, whether village health and sanitation nutrition day is observed and participants is coming for that, etc., can be made as a supervisory checklist. And if any drawbacks, any challenges faced, means during the supervision session, the respective officer will give a suggestion to improve for the Anganwadi worker. And during the successive visits, they can address this, whether it is going on perfectly. This is called a supportive supervision. It is not fine faulting. It is just a correcting measure, so that effective implementation of the program will occur. This is the references for our topic of discussion. And this is a logo of Poshan Abhiyaan. And now it is Eat Right, Think, Eat Right movement. Okay. Thank you.